Well, vitamin K2 is a topic of today's video. Let's see first what is vitamin K. Vitamin K is a group of fat-soluble vitamins that play a crucial role in blood clotting, cardiovascular health and bone health. Here we will discuss the two main forms of vitamin K, vitamin K1 and vitamin K2. These two forms differ in their sources and functions. First we see vitamin K1 sources. Vitamin K1 is primarily found in leafy green vegetables, such as kale, spinach, broccoli, and lettuce. It is also present in certain vegetable oils, particularly soybean and canola oils. Now let's see its functions. The primary function of vitamin K1 is to support the blood clotting process. It helps in wound healing and prevent excessive bleeding. Vitamin K1 is needed for blood to clot normally. All babies are born with very low levels of vitamin K because it doesn't cross the placenta well, and breast milk contains only small amounts of vitamin K. That means that all newborns have low levels of vitamin K, which can lead to serious bleeding problems. Research shows that a single vitamin K1 shot at birth protects your baby from developing dangerous bleeding, which can lead to brain damage and even death. If we talk about vitamin K2 is primarily found in animal-based foods and fermented foods. It is also produced by some bacteria in the human gut. The best food sources of K2 are cheese, egg yolks, and organ meats. Vitamin K2 has a broader range of functions compared to K1. It is involved not only in blood clotting, but also bone health and cardiovascular health. It ensures that calcium is directed to the bones and teeth, rather than accumulating in the arteries or soft tissues, such as blood vessels and kidneys, where it can be harmful. Both vitamin K1 and K2 are important for various aspects of health. They have different dietary sources, and play slightly different roles in the body. Vitamin K1 is mainly associated with blood clotting, whereas vitamin K2 is more diverse in its functions, including bone and cardiovascular health. Vitamin K2 comes in two forms. Menaquinin 4, often expressed as Mk4, menaquinin 7, often expressed as Mk7. There are several forms of vitamin K2, but Mk4 and Mk7 are the most well-researched. Mk4 is found in animal products and has a shorter half-life in the body, while Mk7 is found in fermented foods and has a longer half-life, making it a popular supplement choice. The richest source of K2 as Mk7 is a Japanese dish called natto, which are fermented soybeans. Dietary requirements. The recommended dietary intake for vitamin K2 has not been established as precisely as it has for vitamin K1. However, ensuring a diet that includes vitamin K2-rich foods can contribute to overall health. Vitamin K2 in the form of Mk7 is 10 times more absorbable than vitamin K1. Now let's talk about its health benefits. Health benefits of vitamin K include bone mineralization. Vitamin K is associated with bone mineralization, meaning that bone density maintains its normal state better when consuming adequate amounts of this vitamin. So it promotes healthy bone. Heart health. Vitamin K affects also our heart health, especially in terms of lowering the risk of cardiovascular damage and improve overall health of the heart. In old age, calcification of the blood vessels can happen, which makes blood vessels less elastic and narrow. This can eventually lead to ischemic heart disease. When calcium deposits in arteries, it makes them stiff and impairs blood flow, increasing the risk of adverse cardiovascular events. But this is not simply a byproduct of aging. If we have enough vitamin K2 to activate matrix GLA protein, then we can help our bodies stop calcification, protecting our hearts and arteries remain clear. Whether your diet creates high or low cholesterol, what really matters is whether calcium-fueled plaque is building up in your arteries, leading to a potentially fatal blockage. It is possible to lessen plaque burden by stimulating more MGP to actively sweep calcium away by taking a vitamin K supplement. Even more, taking vitamin K2 could also help prevent the loss of elasticity in the skin and reduce varicose veins. Anxiety and depression. High blood glucose levels may increase a person's risk of developing anxiety, depression, and cognitive impairment. According to a 2016 study which investigated the effects of vitamin K2, it was the result that vitamin K had normalized blood glucose and reduced symptoms of anxiety and depression. What happens if you get too little vitamin K? Of course, it will cause vitamin K2 deficiency. Vitamin K2 deficiency can cause following health conditions: Blood clotting problems, more prone to bruising and bleeding, nosebleeds, increased risk of hemorrhage, inadequate bone mineralization, which can lead to osteoporosis. Blood vessel and heart-related problems, like arterial calcification and high blood pressure, kidney and gallstones, cavities and other dental issues tied to tooth decay, symptoms of inflammatory bowel disease, like bloody stool, indigestion and diarrhea, poor blood sugar balance and high risk for diabetes, metabolic problems, high chance of having morning sickness in pregnant women, spider veins or varicose veins. Adults are at a greater risk of developing vitamin K2 deficiency if they suffer from any of these health conditions. Diseases that affect the digestive tract, malnutrition due to calorie restriction or poverty, excessive alcohol consumption, use of drugs that block K2 absorption, prolonged vomiting and diarrhea. The risk of suffering from deficiency is also due to inadequate absorption of this vitamin because of the use of some medication. Details of medication we will not discuss here. Your daily diet can also be the cause of insufficient absorption, because the absorption depends on the amount of consumed fats, so if your diet does not consist enough fats, vitamin K cannot absorb. Some persons cannot break down fats, can influence the absorption. For example, this can occur in case of removed bile. And side effects: is too much vitamin K2 bad for you? While it's rare to experience side effects or vitamin K2 toxicity from getting high amounts from food alone, you might develop symptoms if you take high doses of vitamin K supplements. However, for most people, even high doses of this vitamin, such as 15 mg 3 times a day, have been shown to generally be safe. Too much vitamin K can also contribute to complications in people with blood clotting disorders. Vitamin K2 supplements: it's important to note that vitamin K2 supplements should be taken with caution, especially if you are on blood-thinning medications, as vitamin K can affect blood clotting. If you have specific health concerns or dietary restrictions, it is advisable to consult with a healthcare professional before adding vitamin K2 supplements to your regimen. Look for a supplement that specifically lists menaquinone if you plan to supplement. Because vitamin K supplements can interact with many medications, talk to your doctor if you plan to take a vitamin K supplement and are taking any daily medication. If you take a supplement that contains vitamin K, the chances are very likely that it's vitamin K1 but not K2. While some newer K2 supplements are now available, the type of supplement matters greatly. MK4, the form of K2 found in many vitamin K supplements, is a synthetic K2 with a short half-life. This means that to get the full benefit of it, you have to take it multiple times throughout the day. Often, an MK4 serving size is thousands of micrograms to counteract the half-life of the compound. However, MK7 derived from natto has a much longer half-life and can be taken in more reasonable doses like those listed above. Remember that vitamin K works with other fat-soluble vitamins, like vitamins A and D, so the best way to obtain these nutrients is to eat foods that provide many different vitamins like eggs and full-fat dairy products. Thanks for watching.